Hey, I'm Dr. Greg Cason. We're here to talk about suicide, but you don't have to be a psychologist to make a big impact in someone's life who might be thinking about suicide. Suicide crosses all ages, all genders, all cultures, all societies. It's something that's universal with all of us, yet it's something that we don't talk about. And that's one of the most important things that you can do, and that's to talk. If you suspect someone is suicidal, you're probably looking at a few warning signs. Some of the warning signs might be something like focusing a lot on death, or making plans like giving away things that they own, or finishing up a will, or telling you that they want certain things to go to certain people. It might be becoming more withdrawn, or showing more despair, or just devolving into a lot of alcohol and drug abuse and just talking about how much they want to die. All of these things could point to someone who's going to commit suicide. Now, one of the very best things you can do is, instead of just remaining silent or beating around the bush, is to sit down with the person, tell them concretely what you've observed, and ask them straight out, are you thinking of killing yourself? Doing such a thing not only will not make them want to do it more, but it will actually let them know that you're safe enough to open up to. Really sit and listen to the person, validate their experience, listen to the pain that they're experiencing, and stay away from anything invalidating or shaming, like saying, you wouldn't do this, would you? Or what would someone else think? That would be something you want to stay away from. Now, when you're thinking about talking to somebody who might be feeling suicidal, know that you're not alone. In fact, when you sit down with the National Suicide Prevention Hotline. That's 1-800-273-8255. That's 1-800-273-TALK. Have that number in your hand, and when you're talking to the person, you can share that number with them. And if you have any trouble and you don't know what to say, you can always call that number as well. And you can call that number before you sit down with your friend and really get the best advice. I'm Dr. Greg Cason, and I wish you the best.